Whether you're fighting, healing, caregiving, treating cancer, or simply searching for hope, this space is for you. Welcome to FU Cancer, where meaningful conversations meet powerful community. My name is Juliette Jorgensen. I'm your host, a registered dietitian and cancer advocate, and together we're turning challenges into connection. Check out our platform on the web at fucancer.health. Welcome, Jonathan. We're so lucky to have you with us.
Thank you for having me.
Of course. So Jonathan Panarello is an adult gerontology primary care certified nurse practitioner working in the Department of Hematologic Malignancies at UCLA Santa Monica. He is originally from Montreal, Quebec, Canada, and received his initial nursing diploma from John Abbott College in Montreal. Jonathan completed a bachelor's degree in nursing at St. Francis Xavier University in Nova Scotia, Canada, and a Master of Nursing Nurse Practitioner degree at the University of Toronto in Toronto, Ontario, Canada. He worked in the Coronary Care Unit at the McGill University Health Center in Montreal for 6 years before moving to Florida in 2017. There, he started as a nurse practitioner at Moffitt Cancer Center in the blood and marrow transplant and cellular therapy department and in hematology oncology. Wow. Jonathan moved to Santa Monica and began at UCLA in November 2020. Jonathan is very passionate about his career and cares deeply for his patients. He hopes one day cancer will be much easier to treat and cure. You and me both, Jonathan. Well, welcome. We are just so grateful to have you here and excited. We'll go ahead and kick it off with some questions. So you've had quite a unique experience working in bone marrow transplant unit, and this can be different from other cancer diagnoses with patients receiving chemo and just going home. What does the transition home look like for a transplant patient?
So, leaving the hospital in the beginning, I mean, you're technically not fully discharged. You have to stay around the hospital, like close to the hospital within like, I think, a 30-minute radius. And you have to stay there for up to a month with a 24-hour caregiver and somebody who's there to, take you to appointments and,
Mm.
check your temperature, and if you spike a temperature, to bring you to the emergency room. So for the first 30 days, you're actually still, if you live that close, you go home. Otherwise, you are most likely put up at a hotel for those 30 days with your caregiver. I mean, during those 30 days, you're having frequent follow-up. You're getting labs drawn all the time, transfusions, your blood counts are still low. And I mean, with that comes, some of the symptoms, like you feel really tired and weak, your appetite's low. And that can happen for several months before that stuff actually gets better. So in the beginning, first few months, you have a lot of kind of those symptoms like the fatigue and low appetite, and you're kind of gradually working yourself back up to, a kind of normal. After that 1 month period, if your counts are high enough and you're not having any signs of complication, you get a little more freedom and you can go
Mm.
home if you weren't already at home. And you're still going to have frequent follow-up visits and labs. These patients typically need a lot of blood transfusions because we give them chemotherapy that totally like ablates their bone marrow, and that's where all of your cells are made. So if you don't have bone marrow, your red cells, white cells, everything's low. And that
Mm.
brings in high risk of infection. So in those days, if you spike a fever, it's considered kind of a medical emergency. So you have to go to the emergency room, get worked up, and you're admitted to the hospital for that. But you're also kind of taught what to do to prevent infections. You're on a special, like in the beginning, a neutropenic diet, avoiding any raw foods, even certain vegetables like especially cauliflower and broccoli because they have like little spots where bacteria can hide.
Mhm.
So we tell patients not to have it, like raw veggies, avoid like broccoli and things like that. And then it's, if any of your family members are sick, tell them to stay away, frequent hand washing. It's really focused on infection in the beginning and preventing infection and kind of all those precautions. Um,
Yeah.
you know, you're expected to go out and do your normal daily thing, but you're on like high alert all the time in the beginning.
Yeah, absolutely. Thank you for diving into kind of the intricacies of what that looks like, what going home looks like. And it's not really going home quite yet for those 30 days. So,
It actually
um,
continues for even longer than a year, but the first year you
yeah.
can't work for like 3, 4 months. You're not
Mm,
allowed to travel for 3 months. At the 1 year mark, you're getting all of your childhood vaccines again because we again get kind of wipe out your white cells and all of your memory cells, so you don't have any more vaccines like you had as a child. So you're
mhm.
much higher risk to get those infections. So these things happen, even after the 1 year mark, you're still being monitored and followed.
Yeah. Yeah. Thank you for sharing all of that insight. That is, I mean, it's a long journey. It's a long journey. So,
Yeah.
pivoting to more of your clinician standpoint, working in oncology is challenging, as we know, for a multitude of reasons.
Mhm.
How does caring for cancer patients on a daily basis impact you? And do you feel like it's more challenging than you anticipated from an emotional standpoint? What does that look like?
It's kind of a shift by shift basis, I guess. It
Mhm.
depends on the patient population that you have on that day. Sometimes you just have like chemo patients that are coming in for like their sixth cycle of chemo, and usually that's actually a positive event because usually after 6 cycles, if it's like lymphoma, they're considered in remission and they're done their chemo and it's going to be monitoring.
Mhm.
So you do have like those happy moments where you discharge patients after they've completed their chemo and they get to ring a bell as they leave and everybody cheers for them. It does come with the difficult cases, and some of those cases do stick with you. And, I still think about, some of the ones that I saw in Florida who, it affects you. And, you try to build up kind of walls. You don't react to it like you did when you're starting out in oncology. In the beginning,
Mhm.
it's like everything's doom and gloom, but especially in this area with so much advancements, you're seeing a lot more kind of positive cases now. But those negative ones do impact you, and you still think of them. And occasionally, you get patients that they're not happy cases, and it is sad. And you kind of have to, I guess, allow yourself some kind of emotion and
Mhm.
just not be completely numb to it, because it's human to have emotion. And if you're going to be
Right.
numb to everything, then you're not. I think patients see it too.
Mhm.
So that's when I when I finish work, I completely tune out work. I go on trips. I play Nintendo a lot. So
Yeah,
it's
do what you
like,
need to do.
yeah.
Yes.
So you have
Yeah.
to get out of that mode when you leave there.
hmm Yeah, and I think that's so true for so many clinicians. I think it's kind of the unspoken truth a lot of us face, and learning how to navigate that can take years. It can take a long time to figure out that work-life balance, and
Yeah.
especially in this field. So thank you for sharing that. It was full of wisdom that a lot of us can really think about and chew on. So thank
I
you.
hope so.
Yeah. And then also, still kind of thinking about support as a clinician, what does meaningful support look like during treatment and recovery from your clinician lens? And what have you seen work in the past that's beneficial for, patients' caregivers to be aware of?
Yeah. So things that kind of show you that a patient's going to have, a good support system when they leave, because it's in these cases really important that they do have that support system, whether it be for, you know, um, transportation, or they do need somebody to talk to. There's a lot of things that are kind of not really spoken about too much, and so they need somebody to talk to. And usually, you'll see a lot of patients have frequent visitors, a lot of family coming to see them. The family wants you to call and give them updates. The problem is when you start not seeing those things and you have patients that don't really have any visitors, nobody's really around, and then it's kind of
Mm.
a lot of times those patients, even transplant, like sometimes we can't do it because they just don't have the support and you need that support. So
Yeah.
you'll see the occasional patient with all of these, complex issues, and we have to sometimes get them put in placement. We have to set up transportation for them because they just don't have that support. But like a good sign while you're, because I work inpatient, so we
Mm.
notice, I haven't seen family around, but most of the time they have a lot of visitors, people calling, asking questions about them, and that's kind of a sign that, they have a support system outside the hospital.
Yeah. It's really good to think about because the support system is huge and it's important, especially going through something
Yeah.
that daunting. And so you kind of touched on this already. As we know, you work very closely with immunocompromised patients. And what general recommendations do you have for balancing quality of life and safety precautions? I know you mentioned the neutropenic diet and kind of explained that, so thank you for doing so. But I guess just recommendations for balancing, living your life while also following the safety precautions that patients need to follow to stay safe.
And that's kind of exactly it. These patients are going through, intense treatments, and,
Mhm.
in our patients, leukemia, lymphoma, myeloma, like under that umbrella, a lot of times our goal, we're trying to cure these patients, so we give them their chemo and it's usually with curative intent. So we don't want you to kind of stop living your life. Like, we want you to be able to function outside of the hospital. A lot of people I've had law students who are coming in for chemotherapy, and we want you to continue those things. We want you to be able to function. And if you're not able to because you have, a bunch of side effects, you're just too fatigued or your counts are too low, like you should actually bring that up at your visits because maybe there's something that we should be doing more to help those side effects like nausea and things like that.
Mm.
We try to pre-medicate patients with nausea medications based on how nauseating their chemo is. And if you're still having a lot of nausea, then, we need to be doing a better job at kind of handling it. So we want you to continue living your lives, go out and work, go to school if you can do those things. We often will write letters. Like for school, I wrote a patient a letter recently asking for all kinds of accommodations, try to do their classes virtual, their exams
Mm.
virtual, extensions, and we ask for those things often. But we do want you to live your life. So if you're going to go to the mall, like we want you to go out shopping, we want you to go to the mall. But if you're walking around and it's really busy and there's a lot of people, consider wearing a mask. If you see a big crowd coming towards you and you don't know them, maybe, move to the other side of the hallway or something. Just general ways to try to not get sick. Wash your hands all the time, bring hand sanitizer
Mm.
with you, don't touch your face. Try to avoid eating, with your hands. And if you do, then really diligently wash your hands. But
Mm.
it is a balance because your life is kind of turned around a little bit, and you do have to think of all these things more so than the average person. So,
Hmm. Yeah, that was excellent. Thank you for sharing all of those useful tips. And also, I really like how you touched on the patient advocacy piece of things and how, you're taking accountability for your role as their clinician, as wanting to help them to live their life. And if things aren't feeling right, that they can say, you know what, I am really nauseous today, or I'm feeling this way, or I'm too tired to do my schoolwork. So that's really important for patients to hear as well.
thanks.
Um, yeah. So just a couple more questions. I know you touched on this before as well. Diving back into the mental health aspect, we know that mental health is integral to quality of life. As a clinician, how do you find moments of joy during your difficult seasons? You mentioned your Nintendo. Is there anything else you do to just personally stay grounded and find some
Yeah.
joy?
So I try to disconnect. And when I'm off, I'm like I mentioned, I'm playing Nintendo, I'm streaming whatever series that I've been watching. I'm a big Disney adult. So I'm
Love
at
it.
Disneyland, I'm collecting Disney merchandise,
Hmm.
Universal, like the little day trips. And because I work 12-hour shifts, so you have a lot of kind of days off in the week. So we do travel a lot, and I try to just live my life,
Yeah,
and have fun.
that's good. That's
I actually,
important.
since I moved to California, I joined
Hmm.
a chorus. So that
Oh.
actually really helped because I was starting to feel more kind of down at one point, and I did feel like
Hmm.
things were affecting me more. And then I joined this chorus, and I actually have rehearsal tonight. But
Exciting.
we're a big family, and I've made so many friends in there.
Mm.
So things like that, like hobbies, and
Yeah,
I think it's one of the best things that I've done since I've moved here. So
absolutely. Yeah, and going back to maybe those childhood hobbies or things you did growing up, like if it's choir or whatever it is for you, if it's band or if it's joining a soccer team, like an adult soccer team, whatever it is, I think it's super important. It kind of keeps us grounded and gives us a life outside of work. So
yeah.
yeah, that's awesome. And then our last question tonight, if you could leave patients, caregivers, and clinicians with one message about navigating life outside hospital walls after a cancer diagnosis, what would that be?
I actually kind of touched on it, but
Mhm.
I like to think that you're not your cancer diagnosis and that
Mm.
you have to keep living. You have to, have some enjoyment. Sometimes, it ends positively, but, sometimes it doesn't. And we want you to be out there and living your life and, enjoying moments with family and friends, and we don't want you to be in a bubble thinking, I can't hug anyone because
Mm.
I'm going to get sick. You're not your diagnosis, and we all understand you have life outside of the hospital walls and outside of the clinic, and we want you to have some form of normalcy and kind of a
Mhm.
really hard time. It's difficult going through this. So I think that's my big point is you're expected to keep living. You're not your diagnosis. You don't have to live in a bubble and do absolutely nothing for the,
Mhm.
almost sometimes year that you're undergoing treatment. So
So true and so important, and just a great reminder for everyone, for clinicians, caregivers, patients alike, cancer advocates, anyone listening. So thank you so much. And it's so clear and just evident to hear in your voice your passion and how much you care. So thank you for what you do. And thank you for being here tonight. It was such a joy and honor to have you.
thank you for having me.
Of course. The conversation doesn't end here. Join our community today at fucancer.health for trusted education, real community, and resources. We are here for you every step of the way.